Assalamu alaikum everyone. Hope you all are fine and doing great. And today, as it's a new year, so first of all, happy new year to everyone. And today we have our guest speaker, Dr. Naghman Zuberi, with us, and he will be discussing about the surface energy, surface tension, and wettability, and their clinical implications. So, without any ado, I would like to welcome Dr. Naghman Zuberi. Assalamu alaikum, sir. How are you?
Walaikum assalam. I'm good, thank you. What about you?
Sir, I am also great. Sir, you can proceed from here.
uh, Welcome everyone, and very happy new year to all of you. So today we are starting with a very unique topic. Actually, this topic is not unique in a way, but usually we do not pay attention to these topics, these uh, subjects, and we do not feel from day to day life we are experiencing all these things. But when it comes to our understanding of the things, we do not pay attention. So from time to time I will be bringing these type of phenomena in front of you, and we will be discussing those, so that when you will be using certain material, your understanding about the utilization of those materials and how you are using those material, uh, it will be much more clearer to you. So let's start with the lecture now. So today we will be discussing about the clinical implications of surface energy, surface tension, and the wettability. Just a minute, guys. Why it is? Can you see the screen, Farooq? Is it okay?
No, sir, no, I can't see a screen.
I think there is a problem with the sharing. Is it okay now?
Um, Sir, yes, it's okay.
Okay, great. Okay, so we will be discussing about the clinical implications of surface energy, surface tension, and the wettability. First of all, what is surface tension? Surface tension is the measurement of the cohesive energy present at an interface. So, specifically, we talk about the liquid. It is the liquid air interface, which actually, when we talk about the water, it converts the water into the shape of drops. We call it liquid air interface. This energy is the result of molecules on the surface of a liquid experiencing an imbalance of attraction between the molecules. And when we talk about the units, it is mn. N is the Newton, millinewton per meter. Falling liquid drops from spherical shapes which have the smallest surface area of all known shapes, and they maintain the state of lowest energy. Here is the lowest energy, that is why they acquire the shape of drops or droplets. Now come the surface energy. So surface energy is the excess energy of molecules at the surface of materials above that of the molecules found in the interior of a material. Say for instance we have a slab. So molecules which are present inside, they have different energy, but those which are present on the surface, they will be having a different energy. That is known as the surface energy. Okay, reduction in the surface energy. Well, anything which is acquired on the surface in the form of an impurity, like it could be an adsorbed gas, formation of an oxide layer, or maybe saliva or other human secretions which are present on the surface, they can cause a reduction in the surface energy and adhesive qualities of a given solid, as these impurities constitute the new surface. Now they have formed a new surface on top of that surface which we are actually trying to bond with something, or where we are trying to achieve the wettability. So first of all, we need to remove that layer which is an impurity. It could be oil on the hands, it could be plaque on the teeth, etc., etc. Different surfaces, they have different surface energies. Like when we talk about the solids, enamel, it is 92 millijoule per meter square. Dentine 87, Teflon 20, gold alloy 51 to 54, nickel chromium 48, commercially pure titanium which we use in dental implants 50, acrylic denture resins 46 to 54. And the liquids, water, it is 72 at 25 degrees centigrade. Mercury, it is 486 at 25 degrees centigrade, which is very high. Saliva 53 at 37 degrees centigrade. Dentine bonding agent, it also closer to the water, and that's why it is able to wet the liquid. Well, say for instance there is a cloth, it's a piece of cloth, and here we have pores. When you are going to wet it, it is going to be wet very easily because there are pores and water can easily be absorbed on the surface of the cloth. But if you apply some oil on it or you apply some wax on it, then the pores are going to be closed and water is going to form the shape of a droplet on surface. Means the wettability of the cloth surface is now reduced. It is the same phenomena when you see the small insects, they are floating over the surface of water in streams or in puddles or ponds. They are actually utilizing the surface tension, and their small legs, they have very high surface, like very low surface energy. It is not very high, so it is not getting wet and they are easily floating over the surface of the water. All of us are familiar with this practical in our physics labs, in our undergrad schools or at college level, when we take two glass slabs and we pour a small droplet of water and then we try to separate those, then it is not easily separable. These two layers, they are not easily separable. Or if we talk about our daily life experience, if you are washing glasses and you stack those together and the water film is formed between the two glasses, then it will be very difficult for you to separate those two glasses. Even if you see some small objects, they can be easily floating on the surface of the water, and you must be playing in your childhood making the paper boats and floating those on the stream or in the puddles, and you would be just looking at it and without understanding that what is happening, what is the surface tension and how these are floating. Even if we look at the huge shapes, they are not sinking in the water because of so many other factors, the physics factor, and one of those is that these combined surface tension is also keeping it away from the sinking into the water. We will come back to the our original example of the two glass plates and the droplets of water. So two glass plates and a water film is formed. The liquid, the water between the two plates spreads because of good wetting. The attraction between the water molecule and glass surface is greater than the cohesive force between the water molecules. Therefore, as water molecules spread, they also pull the two glass slides closer. Small arrows, these, They show the vector of surface tension, and broad arrows show the force that pulls these slides. You are applying the force to pull those apart. The surface tension of water is about 72 mN per meter. For a space of 1 micron, the stress acting on the slide will be almost 140 kilonewton per meter square. Well, when we talk about these things, so certain things which come in our mind is wetting of a surface, wettability, and we apply certain wetting agents. Wetting is relative interfacial tension between a liquid and a solid substrate that results in the formation of a contact angle of less than 90 degrees. The relative affinity of a liquid for the surface of a solid is called its wettability. And a surface active substance which reduces the surface tension of a liquid to promote wetting or adhesion is called a surfactant or a wetting agent. If your hands are oily and you try to wash those, the water is not going to penetrate through the oily film and your hands are not going to get wet. But when you apply the soap, then soap will help the water to penetrate through the oily surface and will make the hands wet and will be able to remove any visible dirt from the hands. Contact angle is the angle conventionally measured through the liquid where a liquid vapor interface meets a solid surface. It quantifies the wettability of a solid surface by a liquid via the Young equation. A given system of solid, liquid, and vapor at a given temperature and pressure has a unique equilibrium contact angle. So actually in the practical means or in the practically in our daily life, a dynamic phenomenon of contact angle hysteresis is often observed, which is ranging from the advancing, which is maximal contact angle, to the receding, which is minimal contact angle. The equilibrium contact is within those values and can be calculated from them. The equilibrium contact angle reflects the relative strength of the liquid, solid, and vapor molecular interaction. So, if the contact angle is very wide, it will be bad wetting. And if it is an acute angle, the wetting will be good. If it is 0 degrees, there will be complete wetting of the surface. For an example from our daily life, like these two blades of the leaves, they are exposed to the similar amount of rain for the similar time period. But over here, the surface energy is very low, and that is why the water is not able to wet the uh, glass leaf, this leaf of the tree or this plant. But over here, its surface energy is very high, so water has made it wet. Wettability was good. Now, what happens in our dental practice? The contact angles of distilled water on set silicone impression are approximately 100 degrees, which makes this group of materials the most hydrophobic among all elastomeric impression materials. No matter they are condensation silicones or they are adhesion silicone, which we call polyvinyl siloxane material, until unless they are hydrophilized. The use of a more hydrophobic impression material may lead to a high frequency of voids in the cast. So silicone impression materials, if they are not treated properly or if great caution is not exercised during pouring the impression, chances of having voids are very high. It is possible to spray a surfactant on these hydrophobic impressions prior to pouring with gypsum mixtures. Clinical studies report that hydrophilized PVS, it yields a significantly higher proportion of void-free impressions than its non-hydrophilized counterpart. You will get very nice details without any voids, very smooth surface and very beautiful surface details. Similarly, when we talk about the adhesive technology, like in our adhesive restorative procedures, the application of surface energy and application of the wettability is also present. The true adhesion has been the holy grail of dental restorative materials for many decades. If true adhesion of restorative materials to tooth structure is to be achieved, three conditions should be satisfied. Number one, sound tooth structure must be conserved, optimal retention must be achieved, and micro leakage must be prevented. The fundamental mechanism of adhesion to tooth structure can be regarded simply as an exchange by which inorganic tooth material, the hydroxyapatite, is replaced by the synthetic resins, and this process involves two parts. Number one, removing the hydroxyapatite to create the micropores, and the second one is infiltration of resin monomers into the micropores and subsequent polymerization. So as a result of these two steps or these two processes, resin tags are formed that micromechanically interlock or interpenetrate with the hard tissue. The following factors can play major or minor roles in achieving adhesive bonds. Number one is surface energy and wetting. Then the interpenetration forming of a hybrid zone. And then the micromechanical interlocking. Then comes the chemical bonding. Wetting is the essential first step for the success of all adhesion mechanisms. An adhesive cannot form micromechanical interlocks, chemical bonds, or interpenetrating networks with a surface unless it can form intimate contact with the surface, which spread over it and penetrate by capillary attraction into any microscopic and submicroscopic irregularities. So these conditions are achieved if the adhesive has the ability to wet the surface or the surface has good surface energy to get wet from the adhesive. Whenever both enamel and dentine tissues are mechanically cut, especially using a rotary instrument, your handpiece and the burr, a layer of adhere, grinding debris and organic film, which we call smear layer, is left on the surface, which prevents strong bonding. Different quantities and qualities of the smear layer are produced by various cutting and instrumentation techniques. The smear layer becomes burnished into the underlying dentinal tubules and lowers the dentine permeability, which is a protective effect. But it also has very weak cohesive forces, or it is a very weak cohesive material. Cohesion is the attraction between the similar molecules of a material, and it interferes with the strong bonding. So what we do to achieve the intimate contact, we do the acid etching. Acid etching not only produces the micropores but also removes the surface smear layer and creates the surface more full of energy so that it is going to accept the adhesive and it's able to get wet. So surface conditioning agents like phosphoric acid is most widely used agent today for bonding to both enamel and dentine. Depending on the concentration, anywhere between 15% up to 35%. Phosphoric acid removes the smear layer and about 10 microns of the enamel to expose prisms of enamel rods to create a honeycomb-like high-energy retentive surface. The higher surface energy ensures that resin monomers will readily wet the surface, infiltrate into the micropores and polymerize to form the resin text. So over here just I have given you a brief overview about how the surface tension, surface energy, wettability of some material and the smear layer or the surface impurities, they can hinder the wettability and they can not let the adherence occur, or they are not letting the adhesive to wet the surface which we are intending to create the adhesion over there. So we are done with our today's lecture, but any queries, any questions, they are welcome, and definitely we will be able to answer all the queries. Any question, any queries are always welcome. You can always send those directly to me, or you can send it to the owner of these channels where we are delivering the lectures. And any topics you want me to discuss, you can always contact me directly and ask me to discuss those. So next week we are going to meet with another topic, inshallah. And over to Farrukh now. Yes, Farrukh.
Inshallah, sir. Thank you very much, sir, for the great lecture. Khuda Hafiz, sir.